Do you think that pressure trainer would be beneficial for somebody who doesn't have a respiratory disorder or is not obese? If we're
Yeah.
talking about from a performance perspective or something like that?
Yeah, there's a paper, and the interesting thing is, a couple things. The more fit you are, especially if you're able to train like above or at your respiratory threshold, your respiratory muscle performance tends to get better, right? Because you use them more often, right? And you've got a pretty wide reserve, even if you have like deficits in strength, like because the amount of pressure you need to generate to bring in a normal breath is like minimal, very very small amounts, and which is good because like you don't want to be working at like 80% of your max to breathe in to perform a very vital function, right? So now there is some stuff out there that suggests maybe for like elite level athletes, using this type of training might engender some benefits. Performance would be very marginal. So I don't think it should ever replace any traditional training, whether it's speed, power, agility, any of those things. But maybe it's a nice adjunct, to do, and maybe and again and to do it the right way as well. So finding if they have a weakness and addressing it. So maybe but I don't think categorically carte blanche for everybody, but only in someone who maybe has a weakness. There was a study out of Brazil which did it in like volleyball players and soccer players and saw some small marginal improvements. But yeah, it's going to be one of those limited marginal gains. But in elite athletes, sometimes that can make that can be the difference, right? Because what we're finding is this one of the primary ways this approach to training or why the diaphragm might be a limit. So I don't know if you guys are aware, you probably learned this back in like undergrad physiology or PT school physiology. There's a reflex in the respiratory muscles called the respiratory muscle metaboreflex, which basically what it does, your respiratory muscle is like a very important muscle to your body. When it fatigues or builds up enough metabolites from fatigue, it signals that it needs more blood flow. And it sends up signals, afferents through the vagus nerve and the phrenic nerve, through the phrenic nerve, and causes vasoconstriction in the periphery and the shunt blood to the respiratory muscles. Basically, it steals blood flow, and that can lead to leg fatigue and cramping. And that's one of the mechanisms for exercise intolerance in patients of heart failure, probably obesity, and like other lung conditions. In humans, that probably doesn't happen except at super normal intensities of exercise. We're talking like 75 mils per kg, like super high VO2s, right? Very high. So maybe for someone who trains at that high intensity, like rock climbers who are just constantly just killing themselves climbing up, or like a super elite, athlete, maybe in some like hockey players might be a good example because they train pretty close to their peak for brief bouts. So maybe for them that might be a benefit, but you have to assess it. So I think in some sports it might be useful in some respects. And then there's also some evidence for patients with asthma or exercise-induced asthma that it might be a great intervention for that, for reducing some of the dyspnea symptoms, as well as potentially improving airway resistance. There was a great paper out of Brazil a couple of years ago which showed that, which was a novel finding, that inspiratory muscle training in a heart failure population resulted in a reduction in some airway resistance characteristics in the lungs in a mouse model in heart failure. But it'd be interesting to see how that plays out in a human model of asthma. So I think in some populations in athletics it might have a use, but that's very, very minimal in some respects. If you're interested, there is another theory that's been floated around that maybe as a warm up. So similar like what you do with jogging, like you do a little bit of or like before a sport, you do like maybe a 1 minute jog, get your blood pumping. Maybe using a device like this, right, to kind of get your blood pumping to your respiratory muscles, maybe that might be effective. And maybe again more for your exercise-induced asthma patients or clients. So that's something we're also looking at, is maybe how does a primer of very sub-threshold respiratory muscle training prior to max exercise, like how does that affect peak exercise capacity and respiratory muscle fatigue? So yeah, So there's, yeah.
That's interesting. A potentiation effect. I mean, why
Yeah.
not? It's there in other respects. It sounds like, at least at minimum, you mentioned all the apparatuses and implements that people use for these things anecdotally. Would you say at minimum, if you're going to do that stuff, you might as well use a device that actually quantifies these things if you're going to do it? Yeah.
That I completely agree. Yeah, that's again, there's a lot of pretty good evidence for this use of these devices. There's especially in certain populations. And the crazy thing is, most of the work, the really good work on these devices is done by PTs. Like it's something that is like, I don't say owned by our profession. It kind of is. The leading researchers for respiratory muscle training are PTs. Respiratory muscle physiology, maybe not so much. Maybe it's more like physiologists and PTs. But like for training, it's PTs, and I happen to know a good bit of them. And it just, like we have conversations like, man, why isn't this stuff just used more often? Like, why are we why are we just making stuff up? Why are people just making stuff? They could use these things here, but yeah.